Experiencing hematuria, or blood in the urine, can be frightening. The sight of abnormal coloration in the urine not only leaves patients feeling helpless, but also makes them worry about severe and complex diseases like bladder cancer. Typically, confirming the cause of hematuria involves a cystoscopy, an invasive procedure for the inspection of the bladder, utilizing a thin tube with a small camera into the bladder through the urethra. This allows a doctor to examine the bladder's condition. However, did you know that only about 10% of patients with hematuria who undergo this procedure are diagnosed with bladder cancer? This means that about 90% of patients with hematuria of other causes could potentially avoid unnecessary cystoscopy procedures. Introducing GALEAS Bladder, a non-invasive, urine-based molecular biomarker test to triage patients presenting with hematuria, providing a viable alternative to conventional cystoscopy while bringing comfort and convenience to patients' doorstep. With over 90% sensitivity in the detection of 23 genes implicated in bladder cancer, GALEAS Bladder serves as a highly accurate, viable alternative to conventional cystoscopy for the detection of bladder cancer at all grades and stages. GALEAS Bladder also has utility in the current non-muscle invasive bladder cancer surveillance pathway, helping reduce the number of cystoscopies required, offering patients not only a viable alternative to invasive cystoscopies, but a convenient and more comfortable option. So, how does GALEAS Bladder work? It's simple. Patients provide a urine sample using a bar-coded collection device, which is then sent to the laboratory. In the laboratory, genomic DNA is extracted and sequenced using advanced next-generation sequencing (NGS) technology. Key somatic mutations in tumour-derived DNA present in the urine sample are analysed and compiled into a straightforward and comprehensive report, enabling urologists to recommend appropriate treatments at the next appointment. With GALEAS Bladder, convenient, efficient, and non-invasive early detection and monitoring of bladder cancer is possible. Consult your doctor and search GALEAS Bladder for further information.